It's a brief talk highlighting, I think, the history of cardiac replacement therapy, particularly with heart transplantation for patients with advanced or end-stage transthyretin cardiac amyloidosis. I think most of us in the field hope that at some point we'll eliminate the need for transplant because the emergence of effective therapies will ideally prevent the progression of disease and eliminate advanced forms of transthyretin cardiomyopathy. Having said all that, we've basically been discovering a lot more patients, and we still identify patients, unfortunately, in the advanced stages of disease. So the talk highlights essentially some of the history, the nihilism that existed about the use of transplantation for transthyretin cardiac amyloidosis, and our evolution with regard to selection of candidates, appropriate risk stratification, novel ways, at least in the United States, that we've begun to allocate organs to such patients, because notably they don't have the ability to get bridged to a transplant with an LVAD or with inotropes. So we've changed our allocation system to I wouldn't say favor, but at least address some of the unmet needs of this particular population. Probably the most important message of the talk, however, is that while we now successfully can do transplantation in these particular individuals, we've learned that heart transplantation in isolation is effective for replacing the heart problem, but leads to a patient who lives longer and suffers the ills of transthyretin deposition in other organs. And so the community, I think, needs to address the idea that if we're going to transplant such patients, we need to bring to bear for their long-term survival and also for their long-term quality of life some of the emerging therapies that we use for non-transplant patients in this particular population.